So first question, how do you take your coffee?
I love an oat milk latte. Oh, wow. It's right here. Thank you.
You're welcome.
When people ask why I went into electrophysiology, I have always said the same answer. It is to buy a drum set. I don't own a drum set, but I hope to one day. But I have some practice pads, and so when I want to let off steam and have fun, I turn on music really loud and I play drums. And my 3 daughters usually dance around in the room and we have a good time. I would say 3 words to describe Minx. Efficient, reliable, and easy.
How do you think this has changed the patient experience?
Well, I think in a couple ways. Probably the most important way that I've seen is just that patients are able to get up and ambulate more quickly. After AFib ablations, after SVT ablations, historically, I've asked patients to lay in bed for 3 hours, 4 hours. That's how I was taught in training. It takes that long usually to get to hemostasis, and so just the ability of a person to get out of bed and to walk, it relieves so much of the pressure on their back and their hips and their legs. I think that's a huge piece to improving, the patient's experience. I think Minx has helped with that.
So what would you say to younger physicians that are just starting out, if they were going to think about using this device in their practices? They haven't done it yet because this is newer. What would you say to these other physicians that are just thinking about using this?
Yeah, I think rely on how you're trained, do what you're comfortable with doing. But as you gain more comfort and confidence in what you're doing, especially when it comes to access, make sure that safe, good access at the beginning of the case, that's a pillar of good closure at the end. I would say give this device and others a try as well. I think, seeing what's out there, this is a device that's going to be reliable. It's going to be easy to pick up. It's something that I was able to integrate into my own practice pretty quickly. And it's the kind of thing that, even if you, let's say you don't get it right on the first few tries, at the end of the day, you can always hold pressure. But it's pretty seamless in how it's used. And I think it's easy to pick up and integrate into your practice.
Okay. Anything else you think of as important to say, or just even that you want to say? Because you're done.
Yeah. No, I think just have fun and enjoy taking care of people. Electrophysiology is so much fun, and we impact people's lives in such an intimate and important way. Patients are doing better, having less AFib, having fewer arrhythmias, and I think just trying to keep that passion about what you do and love it each day.